Okay, so for some reason my computer is not accepting the screen sharing, so it won't let me record. So I'm gonna do it from here. So my case presentation is on a person that goes by PH. She is a 22-year-old female, and she's in the intimacy versus stagnation stage within Erikson's stages of human development. She lives with her grandmother, and she generally has a close-knit family, but they're all struggling with trusting her and her poor decision-making skills. So all of the family relationships are strained at this point. She has a 1-year-old son, no significant medical history, and she was previously hospitalized for suicidal ideation. So she's diagnosed with generalized anxiety disorder as well as major depressive disorder, severe recurrent without psychotic features. She has a history of impulsive behavior and high-risk decision-making. The reason why she came into the clinic was because she had a history of meeting men online and disappearing with them for months at a time. She wouldn't contact or warn her family at all before she left and while she was gone. She was using sex as a means of survival for food, shelter, and clothes. This last time she had disappeared, she had left her 3-month-old newborn son, and also again left without any warning. Her mother is currently taking care of him and took care of him while she was gone. The family was severely impacted by this, and she did not, like I said, contact her family at all for the 2 months she was gone. So barriers. The micro level barriers would be access to internet devices. She's currently not allowed a phone from her family. The meso level would be that the family is trying to take over her treatment and dictate it by setting strict rules. For example, the phone. She's not really allowed to do anything at all without permission, and even with permission, she has to be supervised. Her life is very, very, very strict at this point. And macro would be the custody arrangement with her son, having her mom. Her mom is the one who is watching her son. So she wants to kind of get him back, and so that's the struggle that we're dealing with on that level. So the workers suggested that she participate in group therapy within the agency. She attends a friendship group that was originally targeted for girls that were younger, around high school age, but her maturity level is very low, and it kind of like fits with the younger women that are there. She's able to participate, and she has so far made healthy and stable friendships within the group. She's very involved in volunteering at a nearby homeless shelter, and she attends church every Sunday and volunteers to watch the children while the parents attend their services. So she always presents sluggish. She always comes in with sweatpants, a sweatshirt, very monotone, very flat. She has a very depressed affect. She reports that she uses her coping skills, but it tends to cycle. She'll go a few weeks using them and doing well, and then she stops and she ends up getting into trouble, like obtaining 4 different phones and getting caught, and also getting caught drinking. Even though she's 22, she should legally be allowed to drink, but like I said, that her parents are putting very strict rules on her, and to them that wasn't allowed. The client's perception of her presenting problem. She knows that she has a habit of meeting men online. She knows it's really unhealthy, and she admits that she craves attention, and she craves attention because her family really sheltered her. She likes the freedom once she's had a taste of it, and so when she rebels, it's because of that. Because her family is kind of keeping her very restricted, and she just needs a little bit of freedom. To her, these behaviors are the only way she knows how to experience freedom. So her self-destructive and poor decision-making is what she does in order to get out of that restriction from her family. She knows that her immaturity level is much lower than other women her age, and she knows that she has a problem with appropriate decision-making skills. She knows that she wants to work on it, but at times is not willing to put the effort and the amount of effort and willpower it takes to actually make a difference in her treatment. Support system. She currently lives with her grandmother, and they are very close. She used to live with her mother, and then when she returned from her disappearance, this last time, her mother told her she didn't want her to live with her anymore, and it was because that it really hurt them when she left, and did not contact them the entire time. And also because PH left her son, so that was another reason her mother didn't want her to live with her anymore. They are slowly working on their relationship, and it has gotten better over time. Client's son is residing with her mother. Client's father and her were not on speaking terms until around Christmas. She first came to me in August, so it took 4 months until after she started therapy, to actually talk. And they are very, very, very slowly working on their relationship. Client's brother and her do not talk at all, and if they do, client reports that he's only mean. She does speak with her other brother and her sister, though. Briefly, they're not as close as they were, considering everything that had happened. Client is motivated by her son. That's a really good strength. He's the one person that keeps her together. She wants to do better because of him, and she wants to have him back. Client is also self-motivated in treatment. Lately, she's been more so motivated and is practicing appropriate CBT skills and techniques that we've been working on. We've been going by a CBT workbook, and she tends to thrive in more structured setting like that. So ever since we started the workbook, she's been really working on her skills. Client has goals. She wants to become a medical assistant, and she wants to get a job. The client is motivated by going to church and volunteering at the shelter weekly. These are all of her strengths. So my assessment of the problem. I think her growing up very sheltered did not help, and I think that the only way she knows how to kind of get out of it is to self-destruct. She never really had any pacing herself in regards to freedom, so she doesn't really know how to do that. So she needs more education on that, kind of gradual exposure. She does believe in her family values and going to church weekly, but she also enjoys the freedom that she had when she was away. So she's kind of involved in this self-conflict, if you will. She also is begging to be treated like an adult and given freedom, but she is more restricted, and the more restricted she gets, the more slip-ups she makes, like drinking and getting found with a phone and everything. So because they tend to treat her like a child, this is the reason why she behaves the way she does. She also wants to be treated like an adult, but at the same time doesn't know how to handle all that freedom. So it's kind of like a catch-22. Case plan. So we are continuing rigorous CBT techniques, and that way we can improve her thought process and self-esteem. Self-esteem is a really big problem for her. Another reason why she keeps self-destructing is because she craves attention, because she has very low self-esteem. Okay, and that's the micro level. The meso level would be client will continue to attend church and volunteer weekly. Client will continue to see worker twice weekly, as well as attend group therapy every Friday. Client will also get a job and save up enough money to buy herself a phone. once again, gradual exposure. We want to give her that right to self-determination and just kind of stop her family from dictating her treatment as well. And then once she does that and creates a stable living environment, then she might be able to reunify with her son, or at least have more responsibility when it comes to him. The macro level would be client getting herself to a point where she can properly parent her child and regain full custody. Client tasks. So her first task is 1, to get a phone, and then 2, to get a job. She will write in her daily journal. She will continue her positive daily affirmations that she does before she goes to bed. And she will continue to use the CBT workbook that we've provided for her. And the client will be transparent with workers. So in the past, she had not been very forthcoming with me. She'd been hiding a lot of things like the phones and like the drinking, and she kind of expressed that she was scared that I would be mad at her, but I told her that wasn't my role. It's not my job to be mad at you. It's my job for you to share things with me and me to educate you on best ways to handle things. And so that's the biggest thing that she's working on right now, is also transparency. She's been doing a great job at working on that for the past few weeks, since her last slip up and she was found with the phone again. And then that's when we decided to kind of change course with her treatment and give her a lot more self-determination. Another task the client has is to disclose information herself instead of having me pull it out of her by asking her a million questions. Once again, just self-disclosure and transparency. Client will practice appropriate behavior while using her phone once she gets it. No proper referrals were made, but the client was urged to attend the weekly group therapy, and she is participating in it. Future plans. She will save enough money to buy a phone. She will practice appropriate behavior while using the phone. She will save enough money to provide a stable living arrangement for her son, so that way he can come and live with her. Client will continue to work on her relationships with mother, father, siblings, and grandmother. She will get a driver's license. She currently does not have one. And then client will start attending school to be a medical assistant. Theories and skills used. The theories we use are cognitive behavioral therapy. We use positive thought replacement. We use those worksheets every session. She also does daily journaling, positive affirmations, and using coping skills. Ethical consideration is her maturity level. The possible inability for her to appropriately use technology without demonstrating that poor decision-making behavior and self-destructive behavior, and possible inability to maintain stable employment due to lack of emotional stability. She a lot of times removes herself from situations when she feels a certain way, which is a good coping skill, but when you're at work, you can't just leave because you're anxious. So she might have a difficulty kind of sustaining employment in that way. Another ethical consideration is the possible inability to fully care for her son on her own. And all of this is surrounding self-determination. I kind of have to give her that chance, even though she might not have the ability to do these things. Diversity considerations. She's always, she reports loving church and loving being involved in the community. Client reports that being raised in such a Christian and strict household left her sheltered. She reports that this is the entire reasoning for her wanting to rebel and to seek the freedom that she's not used to having. Policy considerations. It's our policy to stick with the client's right to self-determination. The struggle here is that the client's insight is very poor and the next steps for approaching the situation are very tricky. One option is to trust the client, give her the opportunity to have a phone and behave appropriately, which is ideal. But the other option is to continue to work with her rigorously on CBT and let that itself kind of lead to her growth, and that earn her responsibility of having a phone, versus not being trusted and then disappearing again. Research considerations would be conducting a trial with both of those options mentioned, that I just mentioned, and seeing which one is more effective in her treatment. And discussion questions. What would you do as a therapist in this situation? Would you allow the client her right to self-determination, or would you guide treatment because of the client's lack of insight and appropriate decision making? If she did get a phone, how would you be able to track the client's progression or regression? And then that's it. All right, thanks for watching.